Hi everyone, it's Paul. We're here at the Canadian Massage Conference. I'm here with one of the organizers, Lorna, and she is going to helpfully help us show you the Psoas treatment with a set of cups. Okay, I pre-interviewed her, and you want to describe your problem, or shall I?
I can.
Go ahead.
I sit all day for my job, so on standing, I have like tightness. I have a hard time getting straight. I've got to sort of work it out. When I wake up in the morning, same sort of thing. My left hip is really, really tight. I don't do any stretching. I'm not doing anything, but I feel like I just need a little bit of work on it.
Sure. So you guys have been asking us to demonstrate the Psoas treatment, so here we go. So I'm going to have you just lay down on your back, face up. So this is a wonderful treatment because it can be done over clothes. Because we're doing it over clothes, we're obviously not going to use suction, but I am going to use a hard polycarbonate cup. So our landmarks are going to be our patient's ASIS. We know the psoas goes from the transverse and bodies of the lumbar vertebra anteriorly over the superior ramus of the pubic bone, and then back inferiorly and posteriorly through to the lesser trochanter. So what we want to do is treat the psoas where it's closest to the top of the body, closest to the surface. So what we're going to do is treat it right where it goes over the pubic ramus. So at this point, how do you find it? So you find the patient's ASIS, put your hand on her, and then I have her contract her leg. So lift your leg up to the ceiling for it. Good, perfect, relax. So what I'm feeling for is contraction. There's two things that contract. There's rectus femoris and then the psoas. What I'm looking for is the one closer to my fingertips here. And then I'm going to move my hands a little bit and see if I can feel a pulse, because I don't want to hinge upon the artery that is really close. If her pulse is just lateral to where medial to where my fingers are, so I know I have to be lateral. I feel a little bit more, see if there's that feeling of an empty hose. If there is, I want to move off of that. I don't feel that with her, and you can feel that through clothes. So I'm going to take the cup and just place it where I feel the psoas muscle tightness. Now, we're used to putting our fingers inside someone's abdomen and pushing very hard. This isn't a very heavy industrial treatment. In fact, our patients are going to like this one better because it's not sore. So I'm going to press down a little bit this much force. All I want you to do is rotate your leg back and forth like that, under your power, as big as you can, okay? So what this is doing is having the muscle contract underneath the cup. So I'm pulling it like this just so you can see it. How I normally hold the cup is more like this with two hands. Okay, but so you guys can see it. And I'm just watching the pace of her leg, because as the muscle relaxes, or if the tone comes down, or if the release of that muscular tension she feels happens, what her tendency is going to be is to slow down or stop, because it just happened. It's slow down or stop, or speed up. It's one or the other. And you can relax, okay? And then you take the cup out. And what I like to do immediately is have the patient sit up off the table and go for a little walk. See how it feels. Right. Yeah. So we're going to do the other one off camera, so she's not walking around in a circle for the rest of the day. But it's a really quick treatment, really easy. So good luck to you.